Okay. Hi, everybody. My name is Lakshmi, and I'm the founder of Lakshmi Volker Chair Yoga. And I'm looking at your schedule. And if you want to get in touch with me, it says Get Fit Where You Sit. Don't put any spaces between it. Just put www.getfitwhereyousit.com. And I'll answer any questions you'd like. What I'm going to do today, I've been racking my brain what to teach you and what not to teach you. And the most important thing for me to teach you on the chair, and you're sitting on a chair now up until 2:30 this afternoon. So you want to get fit where you sit. So we start to sit like this, and we start to sit like this, and then we're on the computer, whatever, and we're trashing our neck, our back, our legs, our pelvis. So I want to teach you, I'm going to turn my chair a little bit on a diagonal. So we usually don't fill the whole chair because when we do, notice how we pooch out and the back rounds out. And that's not real good for your kidneys because you want to support them and your shoulders start to round. So I'm going to ask you to sit up and take your buttocks an inch forward toward the front of the chair. And so you have some breathing room behind you. Now, if you have a full figure, you would want to put your hands to the side of the chair, no problem. So we're toward the front edge. I'm going to come to the front now. You want to take your fist. I'm going to move over because I'm in the middle of your wording. Take your fist and put them between your knees to bring your legs hip bone. These are your hip bones. Hip bone width apart. And look down at your feet and make sure there's a parallel line between your feet. You're not sitting 10 after 10 and you're not sitting pigeon toed because that's going to bother your hips and your knees and your ankles. So make sure your feet are pointing forward. Your second toe points forward. Okay? So front edge, hip bone width apart, big toe pointing forward. Now, here's one of the magics in Lakshmi Volker Chair Yoga. In the ball of the foot, under the big toe and the little toe, are two press points, big toe and little toe, and the center of the heel. Now, I'd like you to lift up your toes and press those points down. Now, this pose had a remarkable effect on dialysis people in the Midwest where we taught a couple years ago. And they did this sitting mountain pose, and it just lifted their spirits and made them feel so much better after dialysis and after any treatment. So we had the girls and guys lift up their toes, press down so strongly that you feel like you're going to stand up. And what you're doing is you're building muscle and bone mass in your legs. Okay? So has everybody got that so far? So toes up, 3 points down, hip bone width apart. Now, drop your toes, but press your feet down. Now, take your left hand and remove the flesh from the sit bone. So pull it out of the way and sit that bone down and do the same on the right side. It kind of feels like two little birdies in a nest. You're getting nice and comfortable on your chair, and your chair becomes your friend instead of your enemy. Now imagine you have a little jacket on, and you're going to hold the zipper pull and zip up, zip up, zip up, zip up right to your neck. Put the back of the fist in your neck and drop your chin down. All right. So that brings your cervical vertebrae in your neck in alignment with the rest of your spine. So toes down, hip bone width apart, get some of the flesh out of the way of the little bones in your buttock, zip up your jacket, lifting up the front spine, pulling in the belly. You get an automatic pelvic tilt, and then zip down the back of your body, anchoring your sacrum and coccyx onto the chair. All right? Now, roll your shoulders up to your ears, roll them back, touch the back of the chair. So you bring your wings in your back, your scapulas, bringing your scapulas towards one another and opening up in the chest, opening up in the heart muscle, opening up in your liver, gallbladder, spleen, and pancreas, kidneys, and adrenals. This is such an all-inclusive yoga pose. Now, after you've rolled up, back, and down, place your hands gently on your legs, turned up. In yoga, this means you want to receive. So you're going to receive my next teaching. I want to make sure I keep an eye on the time for you. Okay. Now, so let's close the eyes if that's comfortable for you. And we're going to do a warming breath, a breath that calms us down and brings us peace from the inside to the outside. So inhale through your nose, make a big belly, and then squeeze the belly and exhale from your nose. Inhale through your nose, get the breath down into your belly, and then squeeze your belly and get all the negative feelings and thoughts and dis-ease out by squeezing the belly. Dis-ease means we're not at ease, okay? Thumb and pointer touch. One more Ujjayi breath. Bring in the breath. Hear the breath go down the back of your throat. Fill your belly, ribs, and chest. And then exhale, relax your chest, ribs, and belly. So this pose now, if you can see yourself in the screen, is called sitting mountain, Tadasana. And we sit in alignment. We unload the spine by sitting up. When we sit down on the chair, we load the spine. We sit like this. And none of our glands and organs are going to get the life force, the prana, the chi. Now, as you're sitting up nice and tall, you'll do this sitting when you're on the computer or when you go out to a restaurant. If you're sitting outside or inside now, I don't know where you are with the COVID. And it's a wonderful pose. Now let's do the tree pose. It's a simple pose. It won't affect your kidneys. It'll keep them nice and strong. So I teach levels of flexibility. You could go here, here, or here. So let me show you. With the right foot, just lay it to the side and press it up to the left. That would be level 1 tree. Level 2, you'd cross it over. Now, some of you can get to level 3, but if you're in level 1 or 2, that's perfect. So again, level 1 tree, level 2 tree, level 3 tree. I'm going to stay in level 3. Find your level of flexibility for lower body and then activate the muscles. Squeeze all the muscles, the inner thighs. Press that left foot down. Press the right knee down if you're in level 3, okay? Now, level 1 for the upper body would be right here. Level 2 would be here, and level 3 would be here. So I'm going to go into level 3, and now we're going to breathe 3 Ujjayi breaths. 1, and 2, and 3. Now, if you're in this level of flexibility, you're going to open the arms, but then make sure you turn your palms down halfway. This protects your rotator cuff and acromion process. So it'll release and reduce tension in your shoulders. When you bring the arms up, the palms are down, flip up and come up. Beautiful, everyone. Beautiful job. Now, if the leg is in level 3, bring it down. So stretch your leg out a little bit, point and flex the feet at the heels. And I have a couple minutes. I'm going to show you the acupressure knee movement. So if you have knee challenges, rub the right knee, pick it up, and pump it. Now, if picking it up is too much, just lift and drop the heel. So pump it either way, and then kick the leg out and rub the meniscus area, the inside and outside of the knee, the medial and lateral meniscus. So you're bringing in warmed, oxygenated blood. Pinch around the patella gently to bring the blood into the patella region. And then roll the hand over the patella, but don't roll the patella itself, just the hand. Beautiful. Now pick up and pump. Do this every day if you have knee challenges. Put it down, pick up the left leg, pump it. Do it for about a minute when you're home, or half a minute. Kick it out. And rub, rub, rub. And again, my name is Lakshmi, and welcome to Lakshmi Volker Chair Yoga. Pinch around, go on the website, look at my videos, online videos, and rub around, and then rub, 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 and then pick up and pump, and use your thumbs to rub the outside and inside. Beautiful. Now again, sit bones, hip bone width apart, 3 points in the feet, shoulders roll up, back, and down, hands face up. Oh, fist goes to the chin. Drop the chin down, close the eyes, and let's go back to focusing on the breath. Relax your skull, relax your ears, your shoulders, your arms, relax your belly, your back. Breathe in and out in the kidney area. Relax your buttocks, your legs, and your feet. Bring your hands together at heart center, and we're going to say your greeting that you say when you go to yoga classes, and it's namaste, which means I honor the light that shines within you, that also shines within me. So we fold forward and say namaste. Namaste, ladies and gentlemen. And my tagline is, get fit where you sit. So have a wonderful program. You have a lot of wonderful things to learn and absorb. And I have so looked forward to meeting you. So take care. I think I'm out of time. I'd like to keep going, but I am out of time. So since I'm still here.
Thank you so much, Lakshmi. We appreciate it.
Monica. Thank you. Bye, everybody.
That was fantastic.
Thank you, Monica. Have a wonderful day.
You too. You too.
Bye.
Bye.
All right. Well, hello, everyone, and welcome to the National Kidney Foundation of Illinois 2021 World Kidney Day March to Awareness. I'm Jackie Burgess Bishop, CEO of the National Kidney Foundation of Illinois, and we greatly appreciate you sharing your time with us this afternoon as we raise awareness of chronic kidney disease. If we look at it from the world stage, we're talking about over 700 million people impacted by chronic kidney disease. Nationally, we're looking at 37 million. And if we take into account the at-risk status to 33%, even for the state of Illinois, millions are at risk for chronic kidney disease. So we're here today with this phenomenal program to educate and raise awareness and for empowerment. So what we look at in the month of March, which is National Kidney Month, World Kidney Day is part of that opportunity. But with National Kidney Month, it is my distinct pleasure to introduce the 48th Lieutenant Governor of the state of Illinois, the Honorable Juliana Stratton, who is going to read our state proclamation. Lieutenant Governor, welcome.
Well, thank you so much, Jackie. Thank you for that warm introduction and for your incredible leadership. And I just want to also say namaste, Lakshmi. Thank you so much for those exercises, especially as someone who has been sitting more than I typically do throughout this pandemic. That was really great to join you for those final minutes. To the Board of Directors and staff of the National Kidney Foundation of Illinois, thank you for making this March to Awareness possible. And I'd certainly like to thank all of you who are tuning in today with a special acknowledgement of my state senator, Senator Maddie Hunter. I'm thrilled to be joining you today to read a proclamation in honor of National Kidney Month. And as I do so, I want to commend Governor Pritzker for his courageous and compassionate leadership and for acknowledging a need for heightened awareness about kidney disease. Now, I will read the proclamation. Whereas chronic kidney disease is the progressive, gradual loss of kidney functioning, resulting in decrease in the ability of the kidneys to remove waste from the body. And whereas it is estimated that 37 million adults in the United States have chronic kidney disease, and of those, approximately 90% remain undiagnosed. And whereas without diagnosis and treatment to slow the progression of the disease, chronic kidney disease can progress to end-stage renal failure, which is fatal without dialysis or kidney transplant. And whereas kidney disease is the 9th leading cause of death in the United States. And whereas regular screening and early detection can prevent the progression of kidney disease to kidney failure. Therefore, I, J.B. Pritzker, Governor of the state of Illinois, do hereby proclaim March 2021 as National Kidney Month in Illinois to raise awareness of kidney disease and the importance of importance of prevention and early detection. In witness whereof, I have hereby set my hand and caused the great seal of Illinois to be affixed. And this is noted, done at the Capitol in the city of Springfield, the 17th day of February in the year of our Lord, 2021, of the state of Illinois, 203rd. I will now pass it back over to you, Jackie.
Thank you so much, Lieutenant Governor, and please express our appreciation to Governor Pritzker.
I will do.
As we know, the mission for the National Kidney Foundation of Illinois, we improve the health and well-being of people at risk for or affected by kidney disease through prevention, education, and empowerment. Listening to the proclamation that the Lieutenant Governor read, it served as a very sobering reminder of the challenges and the opportunities that we have to change the trajectory of kidney disease and to continue to promote kidney health. One part we know with our program today and the phenomenal panelists that you are about to hear, it would not be possible without the support of our sponsors. And I definitely want to acknowledge our sponsors, express our appreciation. Our presenting sponsors, Donate Life Illinois, Gift of Hope, and Horizon. Our gold sponsor, CareDx and Nanny. Our exhibitor level sponsorship with DaVita, Fresenius Kidney Care, and Mom's Meals. So thank you again for your generous support. What I like to do now, it is absolutely my privilege and pleasure to turn our afternoon program over to our MC, who is Monica Fox, no stranger to many of you. And Monica works and serves as our Director of Outreach and Government Relations for the National Kidney Foundation of Illinois. So enjoy the program. And Monica, thank you as we move forward.
Thank you, Jackie. And happy World Kidney Day, everyone. I am so happy that you could join us today. We've got an action-packed interactive agenda planned for you, including a cooking demo. Oops, I got ahead of myself. We'll get to that later. Here are a few housekeeping notes. We're in a regular Zoom meeting mode so that we can be interactive. For viewing purposes, you should put your screen in presenter mode. We ask that you stay muted and keep your cameras off. That will make it easier for us to highlight presenters. One way that you can interact through the program is by using the chat function. Some of you have already been using the chat function at the bottom of your screen. So let's start by typing how you're feeling about celebrating World Kidney Day today and after having that fantastic chair yoga session. I know I'm feeling excited and relaxed. Also, maybe drop in the chat where you're joining us from. I'm checking in from beautiful Flossmoor, Illinois. So right now, we're going to have a word from our sponsors. One of our presenting sponsors, Horizon Therapeutics. Dr. Brad Marder is the medical director for nephrology in medical affairs at Horizon Therapeutics, a global pharmaceutical company focused on creating treatments for rare and rheumatic conditions. He has devoted his career to patient care and clinical research and has worked as a transplant physician and medical director for the Transplant Center and as chairman of the Department of Medicine for Presbyterian St. Luke's Medical Center in Denver, Colorado. He has served in multiple hospital committees and as an advisor for Donor Alliance Colorado Organ Procurement Organization. Welcome, Dr. Marder.
Thank you, Monica. Thank you so much. Good afternoon, everybody. I'm actually joining you from Denver, Colorado, where I've been in clinical practice as a nephrologist for 17 years until joining Horizon Therapeutics as a medical director for nephrology last year. And I'm so excited to be here and honored to be with this current company on a World Kidney Day. And I really appreciate the time and the opportunity to virtually bend your ear for a topic that's near and dear to my heart right now. And the topic is gout. Now, gout is actually one of the oldest medical conditions recorded, and it was even described by the ancient Egyptians as far back as 2600 before the Common Era. Most people who have gout experience episodes of acute pain and inflammation in peripheral joints, such as the big toe or the ankle or the knee. And we refer to these painful episodes as flares. Since they occur intermittently, many people believe that sometimes they have gout and sometimes they don't have gout. But it's really important to understand that these symptoms are caused by uric acid crystals depositing in your joints. And unless something is done to dissolve these crystals, these painful flares are going to recur over and over and over, and even lead to irreversible joint damage. So why am I talking about gout at a National Kidney Foundation event on World Kidney Day? I mean, this isn't the National Joint Foundation, right? Well, it turns out that gout is highly connected with chronic kidney disease. The kidney is the principal way that the human body can excrete uric acid, which is the naturally occurring metabolic waste product that causes gout. When you have chronic kidney disease, your body's ability to excrete uric acid can become impaired, leading to higher and higher concentrations of it in your body, and then it can crystallize and lead to these painful flares in your joints. This is why gout is so much more common in people with chronic kidney disease compared to people with normal kidney function. In addition, more and more data are accumulating that when you have gout, uric acid doesn't just crystallize in your joints. These uric acid deposits can occur in just about any body tissue, including your arteries, in your spine, even in your kidneys. And even between flares, when you're not experiencing pain from gout, if your uric acid level is high, these crystals continue to accumulate. This is why it's so important to understand that when you have gout, finding ways to decrease your uric acid is critical to managing this painful and destructive disease. Now, if there's just one point to remember after this brief discussion, it is this. If you have gout and chronic kidney disease, make sure to discuss your gout care plan with your nephrologist. When you have chronic kidney disease, there may be elements of your care that your nephrologist will need to modify for your decreased kidney function. Some medications need to be dose adjusted. Some medications need to be avoided altogether. And involving your nephrologist with your care plan is crucial to making sure that you get the most effective and safest treatments available. But as serious and difficult as gout can be for patients with chronic kidney disease, the good news is that treatments are available for even the worst cases of gout. Through appropriate diet and medications, lowering your uric acid can dramatically improve your health and quality of life and make gout completely curable. Remember, if you have gout and chronic kidney disease, make sure your nephrologist is involved with your care plan so your gout can be conquered and made a thing of the past. So again, I thank you very much for the opportunity to speak today, and more information about gout and chronic kidney disease can be found at goutrevealed.com, and I'll put it into the chat room so people can refer to that later. Thank you again so much from Denver. All the best.
Thank you so much, Dr. Marder. We appreciate that very helpful information about gout. Now, Dr. Anna Ricardo will present Are You in the 33%? Understanding CKD and the Risk Factors. Anna, as she prefers to be called, is a nephrologist at the University of Illinois at Chicago, where she cares for adults with kidney disease and is involved in research studies to better understand risk factors for kidney disease progression. In addition to her busy career and family life, Anna is committed to working with NKFI to educate patients about kidney disease in both English and Spanish. Anna, we deeply appreciate your time and commitment, and it's my pleasure to welcome you.
Thank you so much, Monica, and happy World Kidney Day to everyone. I'm very excited to be here to talk about chronic kidney disease, but more importantly, how to prevent it. So let's get started. The first question is, what is chronic kidney disease, or CKD as we call it? It includes conditions that damage the kidneys and decrease their ability to keep their body healthy by doing their job. If kidney disease gets worse, waste can build up to high levels in the blood and make you feel sick, and complications may develop, such as high blood pressure, anemia, or low red blood cell counts, and weak bones. Kidney disease also increases the risk of having heart disease, and these problems may happen slowly over a long period of time. Early detection and treatment can prevent kidney disease from getting worse. Because when kidney disease progresses, it may eventually lead to kidney failure, which requires dialysis or kidney transplant to maintain life. Now, what are the causes of chronic kidney disease? The two main causes are diabetes and high blood pressure, which are responsible for up to 2/3 of all cases of chronic kidney disease. Diabetes happens when the blood sugar is too high, causing damage to many organs in the body, including the kidney. High blood pressure or hypertension occurs when the pressure of the blood against the walls of the blood vessels increases. And if uncontrolled, high blood pressure can lead to heart attack, stroke, and chronic kidney disease. Other conditions that affect the kidney include glomerulonephritis or inflammation of the kidney, such as lupus, inherited diseases such as polycystic kidney disease, malformations that occurs as baby develops, obstructions or blockages caused by problems like kidney stones, tumors, or an enlarged prostate in men, and also repeated urinary tract infections. There are multiple risk factors that increase the chances of someone getting chronic kidney disease, and some of them are diabetes, as we mentioned, high blood pressure, heart disease, smoking, obesity, having a family history of kidney disease, or being older. Now, how do you know if you have chronic kidney disease? The kidney specialists usually measure kidney function by doing a blood test and a urine test. The glomerular filtration rate, or GFR, is the best way to tell how much kidney function you have. The GFR can be calculated from a blood test called the creatinine, and using certain formulas that include age, sex, and other factors. A urine test will determine whether there's protein or blood in the urine, which may be indicators of kidney disease. In addition, you may need to do an ultrasound or a CT scan to get a picture of the kidneys and the urinary tract. This tells whether your kidneys are too large or too small, whether you have a problem like a kidney stone or tumor, and whether there are any problems in the structure of the kidneys or the urinary tract. A kidney biopsy is sometimes done to check for specific types of kidney disease, see how much kidney damage has occurred, and help create a treatment plan. To do a biopsy, the radiologist or the kidney specialist removes a small piece of the kidney, and the pathologist looks at it under the microscope. Now, the most important part is how can you prevent chronic kidney disease or slow progression of chronic kidney disease if you already have it. Early detection and treatment can significantly slow the progression of chronic kidney disease. Unfortunately, 1 in 9 Americans who have chronic kidney disease are not aware that they have the disease. But once you know you have chronic kidney disease, you can follow these steps to slow down the progression of the disease. You may need to see a nephrologist or kidney specialist like me, who will monitor your blood and urine tests regularly and help you control the risk factors for the disease, including high blood pressure, hypertension, coronary heart disease, and diabetes. It is very important to keep the blood pressure under control, and the first step in doing that is reducing the amount of salt or sodium in your diet. It is also important to choose healthy foods such as low-fat dairy products instead of high-fat ones, choosing vegetable proteins instead of animal proteins, and avoiding sugary drinks. Start an exercise program if you haven't already, and an easy way to do this is to walk for 30 minutes at least 3 times a week. Exercise is a great way to keep your weight in check and improve your overall health. If you smoke, try to quit. Watch your weight, limiting high fat fried foods, and desserts in general, because obesity is linked to high blood pressure, heart disease, and chronic kidney disease. And a renal dietitian can definitely help you plan your meals. You may be prescribed certain medications, such as angiotensin-converting enzyme inhibitors or angiotensin receptor blockers. Those are typically used for high blood pressure, but they are also medications that help slow down the progression of chronic kidney disease. Those with chronic kidney disease stage 3 or above may be advised to limit their phosphorus-containing food intake, such as processed foods and soda, because when your kidneys are not functioning properly, high levels of phosphorus can build up in the blood, leading to loss of calcium and weakening of the bones, making them more susceptible to breakage or fractures. In addition, if your serum bicarbonate level is low, indicating buildup of acid in your blood, your kidney specialist might recommend supplementation with sodium bicarbonate or baking soda. Avoid taking large amounts of painkillers if possible. Non-steroidal anti-inflammatory drugs containing ibuprofen, naproxen, and others can harm the kidneys, especially if they are already under stress from dehydration, for example. If you have diabetes, keep it under control by maintaining normal blood sugar levels and following the diet and taking any medications recommended by your doctor. And preventing heart problems is also very important. This may involve, again, controlling the blood sugar if you have diabetes, controlling the blood pressure if you have hypertension, and keeping the cholesterol in check with diet or medication is needed. Thank you so much.
Thank you so much, Dr. Ricardo. We appreciate you so much. And I learned something new every time I listen to you. And I'm sure this was very enlightening for everyone. So we appreciate you taking time out of your busy clinic schedule. Thank you so much.
It's my pleasure. And today is a special day.
Yes, happy World Kidney Day to you.
Thank you.
All right, I think next we are going to have a word from another one of our sponsors, CareDx. I think I see James coming on from CareDx. Go ahead, James.
Monica, hi. Good afternoon, guys. Thanks so much for having me. We're honored to be a part of this special day. My name is James Sharp, as Monica mentioned, and I am a transplant specialist here at CareDx. We are the leading partner for transplant patients and the transplant ecosystem, and we are committed to improving transplant patient outcomes by providing innovative and intelligent solutions throughout the entire patient journey. Our signature product, AlloSure, is a non-invasive data-backed blood test that measures donor-derived cell-free DNA to identify potential allograft injury and provide improved visibility in order to better manage post-transplant immunosuppressive therapy. Our signature service program, RemoTrack, helps to coordinate blood draws, and we even have a mobile phlebotomy team that will come right to your house for routine and pull your routine blood draws. So if we can cue that video, guys, we'd now like to introduce one of our patients, Joanne, for a quick testimonial here.
My name's Joanne Ferrara, and I had a kidney transplant. My husband was my donor. When we had the transplant, everything went really well, really smooth. But on the onset after the transplant, I found out that I had antibodies. They were very concerned that I could have a potential rejection issue. As time went on, my blood work stayed really stellar, but the antibodies continued to escalate. And they had given me some IVIGs, which I didn't respond to, and they really caused me a lot of side effects. So I had asked them, can you take me off of these IVIGs and let me do the test with CareDx to see if I really need affecting could be affecting the kidney. Kidney biopsies are invasive. The AlloSure test completely changed for me what the future really has been like with this kidney transplant. It was just such a praise report for me.
Thank you guys so much. And Joanne is a perfect representation of a CareDx patient that is committed to the long-term health of her graft, as well as the long-term success. And that's where we are, where we can parallel with patients, with doctors, to give them the best tools possible to make sure that journey is as seamless and comfortable as possible. Thank you guys again for your time. I'm going to be available during the breakouts here to answer questions and open up that dialogue for anybody who has questions or wants to chat with me. Again, thanks again for your time, and congratulations on everyone's success here. Looking forward to our conversations.
Thank you so much, James, and thanks to CareDx for being a great partner in the kidney community. We appreciate you.
Thank you.
Next, presenting Know Your Options, Kidney Disease Treatment and Modalities, is Dr. Vita Landeras. She is a member of Associates in Nephrology, one of the largest and well-established nephrology groups in Chicagoland. She completed her nephrology fellowship at Case Western Reserve University, and she's board certified in both internal medicine and nephrology. And chronic kidney disease detection and management is one of her main interests. Welcome, Dr. Landeras.
Hi, how are you? Hi, my name is Vita Landeras, Dr. Landeras, and thank you for having me here. And I would like to share my screen to show you a couple of slides about the topic I'm going to go over today. Is it showing the slides?
No, we don't see your slide right now.
Here we go. Is it showing now?
Yes,
Okay.
Thank you.
Okay, so today I'm going to go over kidney disease treatments, and mainly once the kidney failed and we start to talk about renal replacement therapy, and dialysis is one of them, basically, which is a form of renal replacement therapy or substitute to the failed kidney, a process in which blood gets purified or blood purification is being done. According to the most recent reported from United States Renal Data System in 2020, in 2018, we had more than 130,000 of patients diagnosed with end-stage renal disease. This is an increase of 2.5% since 2017, the year before. So those patients, they have to go through what we call renal replacement therapy, and mainly the starting point is the dialysis. To go over their option or dialysis treatment option, which basically it can be done in a center, like where patient can go and get their hemodialysis, a form of dialysis that can be done through the blood, and usually it's done in a dialysis center with a care team. They perform all the basically the dialysis treatment for the patient. Typical schedule is 3 times a week, and usually it goes for 4 hours per session. It can be a tad less or more, depends on the patient's needs to achieve a good dialysis. Other form is to get the treatment at home, and it can be done in two forms. It can be still done with the home hemodialysis, and basically at that time we can use the machine that is dispensed to the patient, and after rigorous training in the in-center, the patient will be able with their caregiver can get the same hemodialysis at home. The other form is something called peritoneal dialysis, also can be done at home after a period of a training. The patient also get a machine with a supply and they can perform that form of dialysis at home. I will go a little bit over each dialysis modality to explain. I will start with the peritoneal dialysis, which is a type of dialysis which the patient peritoneum, this is the red lining, is used as a dialysis membrane. This peritoneum structure is an anatomical structure which covers abdominal organ. It's a natural organ filter that can filter the toxin and excrete waste product from the body. This peritoneum has two layers, and between those two layers, we have a pocket or a cavity where we can instill the solution, the dialysis solution, and we let it be there instilled for a few hours. This membrane allows to exchange between the blood and this cavity, the peritoneum cavity. It allows to filter those toxins, extra water, extra fluid, and then we can drain it. This process happens through a catheter that is placed by the surgeon, and the catheter from outside will look this way, as in this picture. The patient will be taught how to care for this catheter to prevent infection. And this is what the one option is to use a cycler, and this is how the cycler may look like. And again, it requires training, so the patient is expected to get adequate training before they are released home with their supply and perform this dialysis again by themselves and with assistance of their caregiver. The peritoneal dialysis option that can be done in two forms, and it's chosen by the patient and their care team. Usually, patient chooses what best fits their lifestyle. One option that the peritoneal dialysis can be done during waking hours, and this can be done using a manual installation of the fluid in the peritoneal cavity using the gravity as it's shown in the picture. Alternatively, peritoneal dialysis can be done during the night using the cycler. It can be programmed, so it allows instilling the fluid inside the abdominal cavity and draining it according to a programmed treatment prescription designed by the patient care team, including the nephrologist. One of the medical advantages of this form of dialysis, the peritoneal dialysis, that it preserves patient's vein and artery for future use. Also, this type of modality have better blood chemistry, flexible schedule, independence, and above all, our patients are able to travel to anywhere in the world. Also, it's usually promoted as preserving patient self-esteem due empowerment of the patient. And also it gives more liberal diet compared to the other methods and modality, and better feel-good feelings compared to hemodialysis. And also research has shown that patients with this modality have better transplant outcome compared to hemodialysis. The downside though of this modality that it requires home supply and storage space, also like all the other modality, risk of infection, and it requires dialyzing daily for the best outcome. However, the other modality, hemodialysis, can achieve the same favorable outcome. There's two forms of hemodialysis. The in-center hemodialysis is done in the center where patient shows up on a certain schedule. They have a chair time, what we call chair time, and he or she will be cared for by a full, a team of dialysis mates, including nurses, renal dietitians, social worker, and a nephrologist. The other form of hemodialysis is home hemodialysis, where the same modality also utilized at home using a machine that is given to the patient after a period of enough training. The thing with this modality that it requires needles to be inserted in the patient access to dialysis. The dialysis access, we call it either AV fistula or AV graft. It's placed by a surgeon, and we require 2 needles to be inserted in this created access, dialysis access. This is how it looks like, but this is from outside. And 1 needle will be bringing the blood outside the body to run it through the machine, through the filter where it gets purified. And the other needle will be basically bringing the blood back from the machine to the patient body after the process is complete. Home hemodialysis or HHD therapy can also be done during the day in any flexible schedule that suits the patient. Usually, the patient will be able to do that after extensive period of a training to trust that the patient able to perform that procedure, of course, on their own, also with help of supportive caregiver at home. They can also do it at night, again, after extensive period of a training. And it's a prescription that is designed by the patient's nephrologist and by the patient lab, and in order to achieve a good dialysis and achieve the treatment goals. Another form of renal replacement therapy when the kidney fails and the patient require a form of a substitute to the failed kidney. Transplant is another form of the replacement therapy. There is a form of a transplant called preemptive transplant that's done before the patient requires dialysis. And the right time for undergoing this evaluation is determined by the patient and by the patient care team, mainly the nephrologist. At certain point of the GFR, the renal function, basically when it is at certain level that it's low enough that we anticipate patient will need renal replacement therapy, we will refer the patient to get a transplant evaluation, and they can be placed on the list to receiving a kidney either from national data or national list, or a living donor if the patient has a living potential donor. If the transplant happens before we starting dialysis, we call preemptive transplant. However, many patients, they can start dialysis and still undergoing the evaluation for transplant, and once they are eligible or they find the right kidney for them, they will go for transplant. We are lucky or fortunate in Chicago that we have multiple transplant centers that allow patients to have choice where they can go, and they choose the right transplant center that suits them and fit their needs. I would like to talk about this figure because I like the fact that there is more and more patients are willing to go to home dialysis therapy. Back in 2018, this line here, it is the line of in-center hemodialysis, that it remains the main form of dialysis in the United States. And you can see the line is going up, and the numbers of patients that they started in-center hemodialysis went up from 111,000 to 113,000 in 2018, and this is a trend that it continued to rise over the past 4 years. However, the number of patients that initiated on peritoneal dialysis, the gray line here, as well as a preemptive transplant, the green line here, also has increased, and it has reached an all-time high of 18,631 patients in 2018. Home hemodialysis is the red line here. So there's more and more patients are interested in home dialysis modality that can be offered, and patients that they can educated about those modalities and other, including the preemptive transplant as well, when they have a conversation with their nephrologist, and they can guide them on the best modality they can have. One last word that, for those patients that they feel that they don't want to go through dialysis or transplant, and they feel that they don't want to undergo further treatment for their renal failure, they need to be reminded that also they will have an option of palliative care. It's also known as conservative treatment, which is a type of treatment to keep patient comfortable. In certain cases, after evaluation, treatment of hemodialysis or peritoneal dialysis can also be given as necessary. This type of treatment usually or mainly is part of end-of-life therapy. It's again a discussion that can be undergone between the patient, their caregiver, family, nephrologist, and of course the rest of the care team, which is the primary care physician as well. This is what I have to say. Okay, I hope it was informative, and thank you so much, and happy World Kidney Day.
Thank you so much, Dr. Landeras. We appreciate you so much for sharing that important information about treatment options. Knowledge is definitely power. All right, everybody, now it's time for our first breakout session. So we're going to separate the attendees into 2 rooms, and our sponsors will be present in the rooms and will share some information with you. Welcome back. We will give, let's see, looks like most people are back, and we're ready to move on to our next session. So next we'll have COVID-19 vaccine updates and information from Dr. Suresh Samson. He's a nephrologist practicing in Chicago and the Chief Medical Officer for Concerto Renal Services. He also serves on the Board of Directors for ESRD Network 10. Welcome, Dr. Samson. Oh, sorry. That was supposed to be Nanny. We have a sponsor break. I'm sorry. Moved ahead too quickly.
That's okay.
Go ahead.
Hello.
I'm sorry, Emily.
Hello, can you hear me, Monica?
I can hear you. I'm sorry.
Okay. That's okay. So hello, everybody. Happy National Kidney Day, and thanks for having me here. My name is Emily. I'm with Nanny, and I'm proud to say that our practice has been a proud supporter of the National Kidney Foundation for many years. We love the education and support that our patients and their families enjoy through NKFI. We love the inspirational and fun events that they put together. And we consider the folks at National Kidney Foundation our partners in the advancement of kidney care. Nanny is a group of kidney doctors. Some of you just heard from one of our doctors, Dr. Kowalski, who answered some questions in the breakout room. They're nephrologists. So our doctors practice all around the Chicago area, as well as throughout Indiana and in New Jersey. Since 1968, nanny doctors have been bringing the best in kidney care to neighborhoods where it's needed most. So thank you so much for participating in this important World Kidney Day event. We're proud to be supporters. And if you need a kidney doctor, reach out to Nanny, please. And I think we now have a video to share with just a minute long. We appreciate the time. That was all for Nanny. Thank you very much.
Thank you so much, Emily, and thank you, Nanny. We really appreciate all of the support and everything that you do for the kidney community. Okay, now we really do have Dr. Sampson to talk about COVID-19 vaccine updates and information. Welcome, Dr. Sampson.
All right, I think you can hear me now, right?
Yes, we can hear you.
Okay, good. All right. Hi, everyone, and thanks, Monica. So I'm going to talk about the COVID and kidney disease. I'm going to include both CKD patients who are on dialysis. We'll talk briefly about some statistics, some numbers about COVID, and we can go to the next slide, Monica. And we'll talk about prevention, and then more importantly, some treatment aspects that are available for all CKD and ESRD patients. God forbid you have to get COVID somehow. And then lastly, we'll talk about vaccine, different options, locations, the various locations where you could get the vaccine. And that's all we're going to talk about today. So next slide. So this is a slide from IDPH, which stands for Illinois Department of Public Health, taken like 4 days ago. Just to give an idea about the vaccines that have been administered in the state of Illinois. So far, sorry, not the vaccine, the COVID cases so far in the state of Illinois. We're close to 1.2 million cases with little more than 20,000 deaths in the state of Illinois alone. The one good part, good number to look at is the recovery rate at the bottom, as 98% of people who get the infection do recover from the infection. Now, this is general population. We're not talking about patients with kidney disease or ESRD. This is general population with a good recovery rate in them. Let's go to the next slide, which shows, this is a good slide to know where COVID has hit the most. And I'll go through this slide in detail. So the top two lines show ages, general population again, between 65 to 74. The second, the bottom set of two lines are people in the age group 75 to 84. So let's go to the first set of lines on the top. The topmost line is the usual mortality in Illinois population in the absence of COVID. This is maybe 2019 when COVID was not here. If you look at it, among the people who die in the state of Illinois, 74% were whites, 13% blacks, and the rest. the COVID has shifted this dramatically. If you look at that, there is significantly higher proportion of deaths in people in the African American community or Asian community or Hispanic community. Significantly more. That is true between ages of 65 to 74. It's also true for ages 75 to 84. Now, a lot of people have talked about why that's the case. What are the problems of behind having these numbers? That's a big conversation to go into, but I just wanted to put this here to know where it's hit really hard, where there and that appropriately there's a lot of focus to get to address this part, get the population vaccinated, so we can prevent this trend from continuing going forward. We can go to the next slide. So we'll talk about prevention by now. I mean, we are almost exactly a year into the pandemic since WHO announced it's a pandemic. It's exactly a year. So everyone is aware of all these things. The three main aspects of prevention are going to be the social distancing, hand washing, and masks. Yes, we have the vaccine. We're slowly getting the vaccines. I think this still has to be the cornerstone for preventing and getting rid of COVID. Applies more to patients who are on dialysis, patients who have CKD, as the risk of someone with CKD or being on dialysis, having a bad COVID infection is a lot higher than a person without kidney disease. Very important that we still continue to follow all these preventive precautions until we completely get rid of COVID. There are a few things I wanted to mention that are maybe specific to patients who are on dialysis. A few simple things, practical things that you can keep an eye on. So to safeguard against COVID. Again, when you go to dialysis unit, try avoid sitting in the waiting area, especially if it is crowded. Try stay in your car if you can, stay outside if the weather permits, and try to avoid sitting together in a closed area for a prolonged period of time. If you cannot do that, let the receptionist in the dialysis unit know that this needs to be addressed so they can make some arrangements for everyone to keep the social distancing part. The second thing, if you are sick, if you have fever, if you have difficulty breathing, call the dialysis unit in advance, let them know so they can always arrange for you to have dialysis done in a safer way, both for you and for the other patients. So allow enough time, let them know in advance. And if you feel sick, get yourself checked and immediately. And when we talk about treatment, I'll tell you why it's so important to get checked for COVID immediately if you feel sick. We'll talk about that later. The third thing is get to know if there are any positive cases in your dialysis unit. Talk to the receptionist, talk to the nurses, be aware of your surroundings, know whether there is any infection. So it will help you understand what precautions you may have to take to prevent yourself from getting COVID. The last is consider doing home dialysis. You can avoid the situation where you are with other patients or in a congested place or in a closed environment. You can stay at your home and do dialysis. I know previous presenters have talked to you about home dialysis and the benefits of home dialysis. COVID definitely as an advantage in terms of home dialysis. So next slide. So I told you we were going to talk about treatment. There are lots of treatment that we have tried and we use for COVID. Most of them are in the hospital setting. So that's for patients who are really sick. I'm not going to be talking about those treatments. I'm going to be talking about this treatment called bamlanivimab. And many doctors, patients, a lot of people have difficulty reading this name or pronouncing this name. So a lot of even doctors call it BAM-BAM. I want everyone to remember this BAM-BAM. It is an antibody that's been approved by FDA to be used for high-risk patients on an outpatient basis. If you get diagnosed with COVID, and you get this antibody treatment as early as possible after the diagnosis, there is a very, very good chance that you will never enter into a hospital or never need a hospital admission. So it prevents hospital admission, or in other words, it prevents people getting sick from COVID. And it's very useful for patients with kidney disease, diabetes, hypertension, patients on dialysis. And the good news is that patients on dialysis can get it done in most of their dialysis units. Their dialysis units will be able to administer it with dialysis towards the end of your dialysis. So it's important for every dialysis patient to get checked. If you think you might have COVID, if you have some sick symptoms, get checked immediately. The next phone call you make should be to your dialysis unit or to your nephrologist saying, hey, I got diagnosed with COVID. Do you think I can get the antibody, or bam, bam. They know what to do. It's a one infusion you get. It's 20 minutes and it can be done with dialysis. And I personally have had experience giving it to at least 5 patients on dialysis. In that 5 patients, no one needed hospital admission. They all got better. That's just an example of 5, but we do have bigger studies that have shown that it is effective. So remember this. And if it comes to that situation, call your nephrologist immediately and get this done. It can also be done in many of the hospitals as an outpatient infusion. So this is for patients not on dialysis. You can get it done within a few hours. You can get it done in an outpatient hospital. So familiarize yourself with this. Let your colleagues and friends and other dialysis patients know if you have, and so we can prevent any major catastrophe from COVID. We can go to the next slide. Then let's talk about the last thing we're going to talk about is the vaccine. As you all know, there are multiple vaccines that are being approved in different countries, different parts of the world. In United States, there are 3 vaccines that are approved. There are 2 of them are what's called mRNA vaccine. They don't have a viral virus in the vaccine. It makes your body produce a protein, and then your body learns how to fight that protein. And when you actually get the virus at a later date, your body already is primed to fight that infection, and it'll fight it out. So there are 2 of those vaccines. One is the Pfizer vaccine, the other one is Moderna vaccine. They both are 2 shots. You need to get 2 shots on both of these vaccines. Pfizer is 21 days apart and Moderna is 28 days apart. Both are very, very effective in preventing infection. We have not had a vaccine which is this effective before. The flu vaccine is nowhere close to this. So this is a lot more effective in terms of preventing an infection. And these 2 vaccines have been studied extensively with thousands and thousands of patients. So far, we haven't seen any major side effects from the vaccine, which can be directly linked to the vaccine. But it's reasonable that there are some patients who have some questions. Hey, what would happen in 5 years from now? Would I get something in 5 years? The answer is we don't know. That's the honest answer. But Pfizer and all our companies and FDA have approved so many vaccines in the last century. They've all been effective. We have eradicated many viral disease, and I'm sure that we will eradicate COVID too. The other vaccine that's approved recently is the Johnson & Johnson vaccine. It is a virus vaccine that it has an inactivated virus in it, pretty much like a usual vaccine we get. It is 67% effective. Now you can always say, hey, it's 67% effective compared to the other 2 vaccines up there. So it is, the difference is that it's 67% effective in preventing infection, but it is 100% effective in preventing any severe infection. So none of the patients who got Johnson & Johnson vaccine had a severe COVID infection, none of them. So it is very effective as well. One advantage of Johnson & Johnson over other vaccines it is 1 shot, not 2. So easy to administer, and it prevents hospitalization. We can go to the next slide. So this is the data on vaccination as of Tuesday. I think as of Monday of this week, we have administered nearly 3.4 million doses of vaccine. That's nearly 25% of the population, or 25-30% of the Illinois population have had vaccines. We want to get it up to 70-80% so we can have a good herd immunity and then forget about COVID. That's the goal. And to get to that level, obviously there needs to be a lot of locations and options for patients to get the vaccine. So in the last 30 days, there have been a significant increase in the number of places where the vaccination is administered. We can go to the next slide. As of now, there are more than 400 sites across this state where you can have the vaccine. Most of them are around the city, but there are a few in almost every county, every town, every city. So in my experience so far, the best way to get the vaccine at this time would be to first reach out to your local hospital. If you are in a hospital system, the chances are you will get it first through your hospital system. But you need to be registered, or you need to let them know somehow that you are looking for a vaccine, or ask your primary care doctor how to register yourself for the vaccine. Some hospitals have a website they want you to register. Some hospitals use the pre-existing app they might have for you to register, and they'll call you. So that would be your quick option. Now, the second option would be to look for your local pharmacies, both Walgreens and CVS. Walgreens have started doing it. CVS will be starting this week or next week. You can reach out, find out where they do, and and it's all online as far as pharmacies are concerned. You can book your appointment as long as you qualify and above age 65. I do have a website documented here, which is the Illinois government IDPH website. It gives you all the locations where the vaccines are administered, and you can register yourself for the vaccine. In the first 2 to 4 weeks, you're going to see every appointment being booked initially. So you have to be quick to get your name registered. But as we go along, more sites will be available, and there will be more appointment times available for you to get the vaccine. So again, follow all the precautions, masking and distancing and hand washing, and get yourself registered to have the vaccine then soon through these locations. And we can go to the next slide. Now, the talk has always been about vaccine, COVID for 2020, now vaccine for 2021. I see that a lot of patients have missed appointments with their kidney doctor, missing dialysis because of that. Let's not forget that COVID will be gone. The kidney problem will still remain. So let's stay on focus, get the kidney problem taken care of, kidneys taken care of, and we can all go from there. I think that's all I have. If you have any questions, I'll be happy to answer.
Thank you so much, Dr. Suresh. We actually do have a couple of questions for you. You have given us some information that, is top of everyone's mind. I think your last point is really key, that kidney patients can't forget to take care of their kidney health. We can't get so caught up in COVID that we forget that. So thank you so much for that amazing reminder, very important reminder. So the first question is, both of these questions come from transplant recipients. And the first question is, post-vaccination, how protected are transplant patients on immunosuppressants?
We have not extensively studied transplant patients for these immunization trials, but it is expected to produce the same amount of protection as it does for the non-transplant patients. So there's no contraindications for transplant patients not to get the vaccine. So I fully encourage them to get the vaccine, and it has this similar protection. We'll get more data as we go along, but as of now, it has the similar protection to the non-transplant patients.
Thank you. And the next question is, will we have to get follow-up vaccinations like a flu shot annually?
We don't know the answer to that, but the chances are yes. We are going to ask, we already started seeing some variants of COVID coming up. So we'll have to constantly learn about this and have a booster dose at some point down the line. Pfizer and Moderna both are evaluating a booster dose already. In fact, Pfizer said their vaccine is already good with the booster, with the variants, but the likelihood is we will be getting a follow-up shot. How long from now? It's not known yet. My feeling is it's probably going to be next year before the winter. We might be ending up getting another shot.
Thank you. Another question, was the Johnson & Johnson vaccine tested on immunocompromised patients? And if so, what does the data tell us about effectiveness?
I am not aware of Johnson & Johnson being tested on suppressed patients, so hard to say at this point. We will get more data pretty soon on that.
Okay, and one last question. I was given, I'm not even going to try to say this medicine, infusion. She was given an infusion due to COVID. I had the first vaccine shot before contracting COVID. Do I have to wait 90 days before getting my second shot?
That's generally advisable. That's what CDC advises, to wait for 90 days. The assumption being once you get an infection, you have antibodies that could at least last for 3 months. There are some patients where it lasts for 6 months or 12 months, but it lasts for 6 months, so you could get it in 3 months from now. Yes, that's the recommendation right now.
Okay, thank you so much. Oh, one more, let's see. Yeah. I read information that states that Johnson & Johnson vaccine were developed using live COVID virus. Is that true? If not, can you clarify?
It does not have any live virus. So it is an inactivated virus, so it is safe to take for transplant patients. It's not a live virus.
Okay. Thank you, Dr. Sampson. This has been so informative and so helpful.
Well, thank you.
We appreciate you. Okay, next, we're going to have a couple of Kidney Mobile screening testimonials. Annually, World Kidney Day marks the kickoff of our Kidney Mobile season. So we thought we'd share a couple of testimonials from people who have been through the screening, and it has had a major impact on their life. Because we serve all communities in the state of Illinois, you'll see one of these in English and one in Spanish.
Hi, my name is Angela Phillips, and I'm very happy to give my testimony on how the National Kidney Foundation has contributed to improving my health and maybe even saving my life. So I work at the Quarry Event Center in South Shore, which is an event center, and we host several different types of entities at our event center. One summer, on a recommendation from another client, the National Kidney Foundation contacted the Quarry Event Center to come utilize the space to set up for their mobile kidney testing site. So we partnered with the National Kidney Foundation, and they came out with all their tools and equipment and whatnot, and the whole neighborhood came out. I was surprised at the outcome myself. The whole community came out over here in South Shore. We had at least about 50 members come out to get their tests done, which included test for diabetes and high blood pressure to see indications that could lead to any type of kidney issues. So with that, as a member of the community, I too went and sat through the process and went to all the stations. There were several stations you could go to get your diabetes test or your high blood pressure. And then there were stations where you could get your information and even recommendations on how you can improve your health. So I went and got my diabetes, and I was great numbers. They were like, no problem here, Miss Phillips, go on to the next station. And I went to the next station for my high blood pressure, and it was alarmingly high, even for the nurse who was taking my high blood pressure. So to my surprise, there was a doctor present. So the people who had issues were ushered into a private conference area with the real doctor. So I went in there, and he was like, well, Miss Phillips, I know you know your blood pressure is high. I'm like, yeah, I know, but I'm pretending to take care of it. And so he just really had a serious talk with me and told me some things about my high blood pressure that I didn't even know about, that my own doctor hadn't told me. So I was and I really appreciated the confidence, the confidentiality, and the relationship that he easily established with me so that I could even take his advice. So I was very moved by the doctor's advice. So I did carry on with my primary care physician and move forward to reduce my blood pressure. So today, maybe about 2-3 years later, my blood pressure is normal. I've been working out, losing weight and getting healthy, and I've remained in constant contact with the National Kidney Foundation, just checking in to say hi, and also to be aware of other programs and opportunities that could perhaps even, save my life or someone else's life. So again, what seemed like a simple checkup turned out to be a life-saving moment for myself. So I'm very proud to have collaborated with the National Kidney Institute to come to the neighborhood to do free testing for the community. And I'm glad I utilized the services, even more importantly, for myself.
Wow, what a great testimonial. I'm trying to hold myself together because we are really saving lives here, and it makes a difference. So I'm so happy that she shared that testimonial with us, and we'll be moving on to the next one.
Sí, buenas. Mi nombre es Yuridia Carvajal y yo tuve un servicio muy especial en la Asociación Nacional de Riñón de Illinois. Y esta asociación dio un servicio excelente aquí en North Chicago. Y yo soy ciudadana de aquí de Waukegan, y he estado, gracias a Dios, he estado bien de salud, pero en lo que cabe me gustó mucho porque tuve la oportunidad de saber cuál es mi estado de salud actual, y eso es un buen servicio para la comunidad. Las diferentes mesas que estuve pasando, eso me agradó porque de esa manera puede uno tener más privacidad también de una mesa a otra o de lo que uno está diciendo. Y estuvo muy bien. Pues muchísimas gracias y espero que pueda hacer este servicio por muchos, muchos años. Gracias por el servicio.
Okay, so we are serving all communities, and especially those that are most impacted and most at risk for kidney disease. Now it's my pleasure to introduce one of my teammates, Dr. Melissa Prest. And since nutrition is such an important aspect of kidney health, Dr. Melissa Prest will be presenting Eating for Optimal Kidney Health. I think this is the part I was so excited about, the cooking demo too. We're so fortunate to have her as a part of our team because she brings a wealth of knowledge and expertise and experience. And part of her role is providing complimentary nutritional consultations to kidney patients. So take it away, Melissa.
Thank you. And thank you. I can share my screen. All right. Give me 1 second. Hello, everybody. All right. Okay, well, thank you for that introduction, Monica. And we're almost through the program. I can't believe it. I feel like today is flying by. So I am going to be talking a little bit, just very high level summary, since we have only a brief time together here today, about eating for optimal kidney health. So it's really going to be more of a high level summary of how the diet changes throughout the stages. As Monica said, I do work with the National Kidney Foundation of Illinois as the foundation dietitian, and I included my email contact there in case you'd like to get in touch with me after this day. Click on this. Hang on. There we go. All right, so we're going to do a polling question first. I have a couple of polling questions in here. So true or false? Once I have kidney disease, it does not matter what I eat. All right, I don't even have to do anything here today. Everybody knows. Okay. Let me see if I can close it on my screen. Can you guys still see the poll? Because it's showing up on my screen.
Yes, we still see the poll.
Anna, is there a way to close this out? Sorry, everyone. I can't close it out.
Okay, I closed it for you, Melissa. I think. Oh, no, it popped back up.
Sorry, everybody. All right, while that's going on, I'm going to move over here and we'll talk about this. So you are correct. It is false that it's very important. And you've heard from a lot of the different presenters here today about the importance of nutrition and your diet for your kidney health. So some of the main goals of nutrition therapy, or the things that I work on with people, is slowing or stopping the rate of progression of kidney disease, maintaining good nutritional status, preventing or minimizing the side effects of uremia or chemical imbalances. So what happens with the diet as kidney disease progresses? So what this little graphic is showing is that based on the level of kidney disease, your kidneys are functioning more or less at a higher normal level or not functioning that well at all. And so depending on what stage of kidney disease you're in, there will be changes to the diet. And I don't want to use the term restriction, because I think a lot of times people think of the kidney diet and they think of restrictions. And it's really more of just a change. We're making food swaps. We're changing what you're eating and maybe some of the amounts you're eating. But I don't like to look at it as a restrictive lifestyle. So in stage one, and I want to say Dr. Ricardo had touched on this earlier in the day, but what we're really focusing on in those earlier stages is the management of our other health conditions so that we can slow any progression or maybe stop any of the progression of kidney disease that may be related to those other health conditions. So high blood pressure and diabetes being those two main conditions that we tend to focus on with those earlier stages. In the later stages, that's when we maybe start to see some changes in blood potassium levels, blood phosphorus levels. And so that's when we start to make some changes in your diet for those nutrients. So in stage one, we're following a healthy diet. And we're going to focus on diet changes that may have already been recommended to you by maybe your primary care physician or possibly your nephrologist. So there's a couple of diets that you may have heard of. So one is the DASH diet. So this is the dietary approaches to stop hypertension. It's been well studied in its role in preventing high blood pressure or improving high blood pressure. And this diet includes lots of fruits and vegetables, whole grains, leaner cuts of meat like poultry, also seafood, fish, beans, seeds, and nuts as other protein sources. It's limited in sodium, added sugars, sweets, and higher fat of meat. So if you look at the picture here of the plate, you'll see about half of that plate has fruits and vegetables on it. So we want it to be really predominantly plant-based. You have smaller amounts of protein and some starches. Now, typically when we think of a protein portion or our starch portion, if we look at the palm of our hands, generally a portion of protein is about the size of the palm of your hand or a little bit bigger, and maybe about a closed fist or a smaller fist-sized portion for a grain on the side of the plate. One of the other diets you've likely heard about is the Mediterranean diet. And the Mediterranean diet really bases physical activity as kind of part of the base of the lifestyle changes. And this was something else that a few of the presenters have talked about, that importance of physical activity in your lifestyle. And it doesn't necessarily have to mean that you're going to the gym and you're, sweating it out and you're lifting heavy weights, because that might not be something that is applicable to you or you're able to do. I like to just encourage people to find movements that are joyful to them. So maybe it's dancing in the kitchen while you're cooking. I've been known to do that. Maybe it's going on a walk with a friend. It's gardening, just anything that's getting you from sitting down and just moving more throughout the day. The base of the food, again, is plant-based. You'll notice it's whole grains, fruits, vegetables, beans, herbs, healthy fats like avocado, and then fish and seafood at least twice a week. Dairy foods in moderation, so smaller amounts, but still the yogurt and cheese. And that's something else with the DASH diet, is that low-fat dairy is included in that diet as well. Meats and sweets less often. So very similar diets. So poll question 2. This is something I hear a lot from people that call into the office or I talk with. So if my kidney disease progresses, I should limit beans and whole grains. All right. So the majority that responded said false and some said true. And so I'm going to stop sharing. I'm going to move this, close it out. Yay. So it really just depends on what is going on with the blood potassium, the phosphorus level. Historically, beans and whole grains have been lumped as high phosphorus foods. So they do technically have higher amounts of phosphorus than a refined grain would, but our bodies don't absorb all of that phosphorus from it. So it actually ends up becoming a really nice protein option that could be a lower protein option that actually doesn't have as much phosphorus that we would be concerned with as we maybe thought. So the one thing that I would caution is if your potassium level is something that is being managed by a physician and that you've been told to limit high potassium foods. So that would be a place where you would work with your healthcare team to really figure out how much of these foods can I include in my diet, my everyday diet. These are some of the core components of the kidney diet. We want to make sure that you're eating enough. A lot of times when people think about the diet, they start to restrict a lot of these foods. Maybe they've read something or they've heard something from someone, and they're over restricting where they're not actually eating enough, and they might have unintentional weight loss. You want to make sure you have the right amount of protein, not too little, not too much. We've talked a lot about reducing sodium throughout the day-to-day, phosphorus, potassium, fluid management. So that's just how much you're drinking. And then micronutrients, those are your vitamins and minerals. So in stages 3 and 4, you may be asked to limit the amount of protein you eat. You may also be asked to change some of the type of protein. So when we think about limits, so we said before, the palm of your hand is about a normal serving. You might be asked to eat 3/4 or half the palm of your hand in your protein option for your meal. Reducing protein in the diet prior to being on dialysis in stages 3 and 4 has been found to be protective of your kidneys. You may also be asked to limit phosphorus or potassium-rich foods, and this is really going to be individualized based on what's going on with you, and it's not a general recommendation for all. What I do recommend and encourage all people living with kidney disease is to get familiar with phosphorus additives and start to limit those in your diet. Phosphorus additives are abundant in our food supply. They are generally recognized as safe, and they've been added to make food shelf stable, make them taste better, help foods that wouldn't normally melt to melt, keep things from separating. But we absorb about 90 to 100% of those. So if you're someone that's struggling controlling your phosphorus level, one of the easiest changes to make is to limit foods with phosphorus additives. So this is something that's being researched, and it's, I think, more of the current thinking or maybe the trend in the kidney diet for people that are not on dialysis. It's looking at a plant-dominant, low-protein diet, or Play-Doh. So we talked about that, palm of your hand, a little less than the palm for your protein. We want about half of the foods that you're consuming coming from plant sources, which is pretty similar to the DASH and Mediterranean diet. We're still limiting the amount of sodium. There's a lot more fiber in this than maybe what we normally think of, and that's coming from our whole grains and our beans. And then calorie levels should be pretty normal, or sometimes you may need a little bit more. And so this diet's really been studied to look at, is this protective? Is this helping with delaying and preventing kidney disease? And a lot of the people that I talk to and work with, we work in some more plant-based or plant-focused meals with their regular kidney plan. So then when we get to stage 5, non-dialysis and then dialysis, you continue with the lower protein until you start dialysis. Dialysis, we lose a little bit of protein every treatment. So we want to replace that with the foods that we eat. And so people that are being treated with dialysis will have higher protein needs. People that are treated with peritoneal dialysis versus hemodialysis may actually have a little higher protein needs because they're doing dialysis more frequently than the traditional in-center 3 times a week. And limiting phosphorus and potassium starts to come a little bit more into play here, because if you remember from that earlier slide, you don't have as much blood filtering through your kidneys, so the function isn't there like it was in the earlier stages, and we start to see increases in the blood phosphorus and blood potassium levels. And then fluid is very commonly limited in those who are on dialysis or getting to the dialysis point. Again, we're not able to eliminate as much fluid from our body, so you may have an increase in swelling in your lower legs or around your heart, which can make it difficult for your heart to pump and for you to breathe. And then transplant, we really focus a lot on food safety, because those who are who have received the gift of a kidney are usually on medication to suppress their immune system. So we want to make sure we're helping that out by really focusing on food safety, and then also managing any complications that may come if there's an increase in blood sugar or weight gain, so forth. All right, last poll before we get to our cooking demo video. I can take charge and optimize my kidney health by changing what I eat. And yay, most people said that they can. So thank you so much. I am going to stop sharing that. I'm going to move this, and then we're going to play our cooking demo video.
Let's make the zucchini tortilla bites with some arugula, tortilla, zucchini, cilantro, and lime. So first we're going to preheat our oven to 375 degrees Fahrenheit and then cut the tortilla into triangles. Here I'm using a pizza cutter to cut the tortilla into triangles. You'll continue doing this until all of the tortilla has been cut. If you don't have a pizza cutter, you can use a knife or kitchen shears. Next, layer the cut tortilla onto a sheet pan that can then go into the oven to crisp. Let's make zoodles. Here I am using a peeler that has wide teeth so I can make little ribbons of zucchini. You can use a regular peeler and just have wider ribbons, but this is a good way to get your ribbons and make your zucchini noodles. When that's done, we'll start to chop and get ready the cilantro. So for this, I use a herb snipper, and this really helps to remove the leaves from the stem by putting the stem through an appropriate size hole to remove those leaves. So when I'm done getting the cilantro ready, I like to go back in and make them a little smaller by using kitchen shears to chop them up into smaller pieces. So next we're going to heat the zucchini and the arugula in a pan with some vegetable oil. So you'll see I am putting in the oil in the pan. I've just turned the burner on so the pan is not hot yet, and I'm going to add in the arugula and the zucchini. Now I'm going to zest the lime. You could do this earlier in the recipe, or you can do it now as I've chosen. It's really up to you. I'm using a microplane and I'm finely grating the skin of the lime to get little bits of the skin to go into the pan for some extra flavor, and this is what we call zesting. And when I'm done zesting, I'm going to cut the lime in half and then squeeze it into the pan. So now that our tortillas have crisped in the oven and we are ready to top them. So you'll see they've been topped with the zucchini and arugula mixture, some cilantro, and a little bit of red pepper flakes.
Okay. Wow, that looked delicious. And everybody who registered should have received the ingredients to make that. So, and the recipe was emailed to you, I think twice. I know it came out this morning. So the first 150 people that registered by a particular date because we had to get the list together and get everything sent out, would have received the items to make that kidney-friendly recipe. So we hope you will make that recipe and enjoy it. All those items are kidney-friendly. Thank you, Melissa, so much for that very informative presentation and the great cooking demo. Now we have two more testimonials from regarding our kidney screenings.
My name is Otis James. I'm here to speak on behalf of my experience with the Kidney Foundation that came up to my job a year ago, and the experience is basically saved my life. It started with they would set up in our auditorium, and a coworker asked me to go get tested. You know, a lot of guys don't like going to see doctors, but they forced me to, so I went, and I was very, very nervous. But they was there with open arms. They helped me relax. You know, you could tell that they really want. They was there for me in support. They wasn't just doing this because of their job. So went to different stations to get different type of tested. I'll make a extra long story short. Health-wise, I had high blood pressure that I wasn't aware of. You know, I felt fine, but if anything, what they taught me is because if you feel fine, don't mean that you're fine. So that's why it's very important throughout months to get tested on your body, especially the older you get. So it was extremely high to a point where I think I should go to the hospital immediately. And they was there with me. They said, if you wanted to go now, we'll sit with you. We'll go with you. They felt me, helped me really to relax because I was very nervous and scared. So as of now, I've been to the hospital 3 times. I've lost weight, you know. I'm about to end up having surgery. I got my blood pressure down to normal, and it's all because of their experience. I thank them so much, and I'm glad to support and help them. I hope I see them again. You know, just to keep getting checked up is very important. Thank you so much.
Wow, thank you, Otis, for sharing your testimony and letting us know that we made a difference in your life. And it helps to hear feedback from people who have really been impacted by getting screened and knowing their numbers. That is so important. And remember, the screenings are free, and we work with communities all over the state to provide this free service so that you can prevent kidney disease or prevent the progression of it. But knowing your numbers is important. So we have one more testimonial, and this one is in
Carvajal. Yo recibí unos servicios por la Fundación Nacional de Riñón de Illinois. Esta fundación gratuita, gracias a Dios, nos ayudó a ver cómo estábamos de salud, mi familia y yo, y fue muy generosos en la explicación de todos los síntomas que, de sangre, de, bueno, todos los síntomas de salud. Me dio a conocer un poco más de qué puedo mejorar en mi salud, y más ahorita en esta pandemia que no ha sido fácil tener buena salud nacionalmente. Entonces estoy muy agradecida por la fundación y por este servicio que fue gratuito. Muchas gracias y se les agradece sus servicios.
Thank you so much for that testimonial. She says she was so grateful to us for the screening and that our personnel were so helpful and thorough, and they explained everything to her and her family about how they could maintain good health. So we will just keep on moving along. And the next thing we have is one more breakout session, and then another presentation after that. So this is time for the second breakout session. We're going to separate the attendees again into 2 rooms. You'll hear from 3 different sponsors, and one of my NKFI teammates will be there to moderate for you. So I'm going to go ahead and introduce our last session, but certainly not least. Marion Shuck will present organ donation, one voice, one vision to save and heal lives. Marion is the Vice President. Marion is the Vice President of Governmental Affairs and External Relations for Gift of Hope Organ and Tissue Donor Network. Marion also serves as the chairperson of the Donate Life Illinois Committee and the president of AMAT, the Association for Multicultural Affairs in Transplantation. Donate Life Illinois and Gift of Hope are both definitely happy to have their support. Marion is also my friend and mentor who taught me so much of what I know about outreach. Welcome, Marion.
Good afternoon, Monica. Good afternoon, everyone. I'm so delighted to be here today, especially delighted to support the National Kidney Foundation of Illinois on their World Kidney Day. Congratulations on a great program. And I am ecstatic that you asked me to participate in this momentous day. The important thing about this is that the National Kidney Foundation of Illinois has partnered with so many people, but there's a core collaborative that has one goal as we talk about organ and tissue donation. And as she mentioned, those key partners are the Association for Multicultural Affairs and Transplantation, for which I am the president, Gift of Hope, for which I am the vice president, and National Kidney Foundation of Illinois, which I'm so thrilled to partner and collaborate. Then we have Donate Life Illinois, where that is a collaboration between NKFI, Gift of Hope, Transplant Games Illinois, the Secretary of State's office, Mid-America Transplant. And so we all work collaboratively, and then also Mid-America Transplant. And we're instrumental, and we work collaboratively to one goal, and that is to educate and provide opportunities for all communities to understand the importance of organ and tissue donation. And so we do this in a most collaborative and concerted effort in making donation happen in Illinois. We really provide a succinct and concise message around donation, whether it's deceased donation or living donation, because in our mind, donation is donation. And so we want all our constituents, all of our patients to be able to advocate for themselves through the donation process. You've heard countless people speak today about donation, how you have to eat right, how you have to be transplant ready. So it is really a concerted effort to really support each other across the organ donation spectrum, but making sure that the message that we are disseminating supports one another. And we do this in all types of ways. As Monica mentioned earlier, it's through grassroots efforts that we do this, because all communities have different needs when it comes to organ and tissue donation. And I'll talk about that in a little bit. But we want to make sure that the message that we are putting out is able to support and sustain communities and to give them the information that they need to not only advocate for themselves, their families, or loved ones and friends, but also to really understand the process of donation. The other thing we do collaboratively is we dispel myths and misconceptions around organ and tissue donation, because many of our communities, especially communities of color, have concerns about healthcare and whether they will be treated correctly when it comes to organ and tissue donation. And then finally, as we talk about our common goal, it's really, again, helping the community understand just the process of donation. I tell you, a lot of people know that donation is the right thing to do. They know that altruistically it's a good thing, but a lot of people don't participate because of myths and misconceptions, because of mistrust, and also because they don't understand the process of donation. We work collaboratively with the Secretary of State, but it's like buying a new car. You get your new car, maybe you get it in, say, May, and then you get to November and you're like, oh, time has to go back. How do I set the clock? Well, you can open up your glove compartment and pull out your manual and understand how to set your clock. But sometimes when you're in the DMV or you register online, you don't get something concrete that tells you what comes next after donation, after you register. So that's our role collectively, is to help people understand what does come next after donation. And it's about building trust. We have to build trust across the spectrum, but we really need to build trust across communities that are diverse. As I mentioned earlier, you know, a lot of myths and misconceptions. A lot of people still believe that if they get into a car accident, they will, you know, look at their driver's license and then, you know, not take care of them so they can be an organ donor, and they can be an organ donor for somebody who is rich, who is white. Well, that is not the case. And we spend a lot of time, Monica and I've spent a lot of time on the road and at events, you know, dispelling these myths and misconceptions. A lot of people believe religiously they have to take their organs with them. That is not the case. We heard from nephrologists in the breakout sessions and earlier today that, you know, you really can get ahead of kidney disease. You can take care of yourself. We heard from the nutritionist who said that if you change your eating habits, you can eliminate kidney disease if you're not that far down to end-stage renal failure. And so it's really important. As you saw, a lot of our testimonials were for people of color, Black, brown. And there is a huge percent that are waiting on the list. Almost 30% of people waiting for a kidney are Black and brown. And so we want to make sure that we empower those multicultural communities to save and heal lives through organ and tissue donation, and that we also support them in that process. And so we do this in a couple of ways, and this is all the entities that Monica has pulled together today for World Kidney Day. And, you know, we've done this way before COVID has just heightened what has been happening. It has heightened the disparities for communities of color because of the impact that COVID has had on these communities. It has highlighted the fact that there's a lack of access to healthcare for these communities. And so we've been doing this long before COVID hit, you know, because as a collective, we understand, respect, and educate all communities. Doesn't matter race, ethnicity, gender, we educate all communities. And we are constantly being educated by each other on best practices to support the communities. And we recognize that we have to be grassroots. We have to go where the communities are, whether they're at work, their play, their school, their religious affiliations, their professional or personal associations. We recognize that we have to take that message, you know, very low or very high. And so it's important for us to work collaboratively in that vein. And then we also, you know, engage and create culturally relevant platforms, initiatives, collateral material that's geared toward the communities that we are trying to impact. And so, you know, we have materials in Spanish, we have English, Gift of Hope, we have materials in Polish. We also work collectively with, you know, our communities, our Greek Orthodox. It doesn't matter. Diversity is just important, and it's inclusive of our entire spectrum. In these organizations, we do it as a circle of donation. We really work together to create the circle of donation that will allow us to support the people in our community. And ultimately, we really recognize, as Vice President Kamala Harris said the other day, the righteous concern for communities of color in how they feel about donation in healthcare. But our collective mission is to save and enhance all lives while giving people a second chance at life, all through organ and tissue donation. And it is through the World Kidney Day that we can put this platform together. We can support Monica and Jackie Burgess Bishop in their initiatives to run National Kidney Foundation of Illinois, because the message is the same across all of our organizations. And I welcome people to call us, because what we want at the end of the day is, whether you have concerns about donation, whether you still have mistrust about donation, it's really important to know who to go to find out the truth about donation, or find out, it's been 50, 60 years since a lot of these big, huge mistrusts have happened within the healthcare community for people of color. But now we're past some of that with, modern technology, with nephrologists and transplant surgeons that are doing and creating new ways to do transplants every day, with partnering with living donation. Living donation can cut your time on the transplant list. You can ask a friend, you can ask family, you can even get kidney or partial liver from someone you don't know. But it's really understanding the donation process that will help you to advocate. And so all of these organizations, from the Secretary of State, where you go and register, to Mid-America Transplant and Gift of Hope, who service the entire state of Illinois together, through the National Kidney Foundation that is providing, nutrition initiatives, who providing the Kidney Mobile, and who are providing grassroots education, that really helps us together. And as we support these initiatives, we want the community to support them as well. You've heard today how, just going in the Kidney Mobile and showing up has changed people's lives, has detected disease, chronic diseases earlier, and people were able to make a change. And so I just want to say thank you and congratulations to the National Kidney Foundation for all that they do, for being an amazing partner and really caring about people and making a difference in people's lives. And I'm just so thankful to be a partner. Thank you so much.
Thank you so much, Marian. Your partnership means the world to us, and we are so happy about working together with Gift of Hope and Donate Life Illinois and AMAT and everyone. And we are glad for the difference that we're going to make together in the community, or continue to make. This was an incredible program, and I really have to thank our presenters, including Lieutenant Governor Juliana Stratton, for coming on and presenting us with the proclamation for World Kidney Day. We are so grateful for the time that you took to be here with us here today. And if you know anyone who missed it, the recording will be available on our website for viewing at your convenience. I must also thank our amazing World Kidney Day committee, led by our Senior Director of Programs, Rachel DePaul. I always say it takes teamwork to make the dream work, and I am a member of an amazing team, most of whom, everyone that you didn't see, they're all behind the scenes working. So let's see, I want to thank our sponsors again, our presenting sponsors, Donate Life Illinois, Gift of Hope, and Horizons Therapeutic. I also would like to thank our gold sponsors, CareDx and Nanny. I'd like to thank our presenting sponsors, DaVita, Fresenius Kidney Care, and Mom's Meals. Your support of this program and NKFI in general is really appreciated. If you're not on our mailing list, visit nkfi.org and sign up so that you'll receive information about our programming. And also, I want to remind you to follow us on all our social media platforms. And please subscribe, download, listen, review, and share the Journey Continues podcast. It's a podcast where we share powerful stories of kidney disease, organ donation, and transplantation. And each one includes a health and nutrition tip at the end. It's available on Apple Podcasts, Google Podcasts, Spotify, and Stitcher. Happy World Kidney Day, everyone, and thanks for joining us.